What has health professionals so worried about the coronavirus is there is no specific medicine to treat or prevent COVID-19. If you get sick, all doctors can do is supportive treatment to help a patient breathe. So joining us now to discuss the possible treatments that President Trump announced today is CBS News medical contributor Dr. David Agus. So David, so good to have you. One of the drugs is actually a half-century-old anti-malaria drug. How does it work?
It's pretty wild, right? Hydroxychloroquine is used for malaria and rheumatoid arthritis, and it works by two mechanisms. One is it blocks virus, and the second is it tempers down inflammation, both of which play a role probably in how it's benefiting patients with COVID-19.
The other drug that the president mentioned was created to treat Ebola. How would that work?
So that is another antiviral. This one is intravenous compared to the first one. Hydroxychloroquine is oral, and remdesivir is an intravenous drug that blocks the virus. You know, this is a virus, it's not alive. The virus actually goes into our cells and uses our own machinery to divide. And drugs like remdesivir can inhibit those processes, enabling the virus to stop dividing, and that's how we benefit from it.
If you have COVID-19 right now, what do these potential treatments mean for you?
If somebody has COVID-19 now, I want them to talk to their doctor about the potential role of using hydroxychloroquine today. It is a FDA-approved drug for other indications, and they can write a prescription today for this drug and use it in the right setting. And that doesn't mean every patient needs to be on it, but it's a discussion to have with your doctor. There is hope, and this drug is hope personified to every person with this disease.
We saw the cases spike in just the last 24 hours. Where are we on this curve?
I'm optimistic, I'm hopeful with the behavior changes our country has made, as well as with these medications announced today, that we're really at a new point, and a point where I could see at some point light at the end of the tunnel.
What's the most significant behavioral change you've made?
You know, my children and my wife, we are staying home, and we're going out for things like this, where it's a very controlled environment. We're eating together as a family. Both of my children are home from college, and every night I have dinner with them. To me, it's a gift. I mean, you have to find positive in some small places in this horrible tragedy that hit our country.
More family dinners. Thank you, Dr. David Agus.
Thank you.